currently 6:15. I want to begin with the roll call. And just so we can move this evening along, we are at 6:15 right now. So I can see that we do have 21 participants in the meeting, which is fantastic. Do the commissioners just want to pop up really quickly, introduce themselves so the public know exactly who you are?
Hi, I'm Caroline Obrecht, and I'm the vice chair.
I'm Betsy Beach, and I'm the secretary.
Hi, I'm Drew Balsley, and I'm a commissioner. I didn't know David is saying, should I go next? I'm David Maloney, and I'm a commissioner. Hi, everyone. Hello, I'm Tim Riker. I'm a commissioner. Nice to see everyone.
Boomy, would you like to introduce yourself?
Boomy, you're muted.
Oh, sorry. I'm Bumi Osho. I'm a commissioner.
And then I believe Ernest is on as well as our executive director. Hopefully everyone knows who Ernest is. I'm Kimberly, AKA Kimmy Marthers, and I'm the newly appointed chair. I think if we've introduced the commissioners, which I think not missing anybody in our introductions at this point, we can begin with our mission statement, our vision, and our guiding principles. I'm not sure if anybody has it directly in front of them. If anybody wants to, as a commissioner, read them out. If not, I may ask Bethany if she can just place them up, and I'm gonna choose somebody to read them for us. And I think I'd like Drew to do it tonight, only because it's been a while since we've had Drew in our company. So Drew, if you are able to, once Bethany pulls that up, we can take a look.
I have
And,
that.
Sure.
Excellent, thank you, Drew. So Drew, just the mission statement, if you would.
And I just, for the interpreter, am I still also, I don't know if I'm visible to her. She's saying I'm the only one spotlighted here. So the mission statement for the Rhode Island Commission for the Deaf and Hard of Hearing is to provide innovative leadership and public policy, advocacy, service delivery, and accessibility throughout the Ocean State. RICDHH ensures opportunities for every deaf and hard of hearing person to become an empowered and contributing citizen. Thank you.
Thank you, Drew. Okay, we'll just. All right, I'm not sure, Bethany, if you have our vision and guiding principles accessible to you, just so we can all see it.
Is this what you would like,
Yep,
Kimmy?
that's perfect. I'll actually read our guiding principles. Thank you. So firstly, communication to ensure that all Rhode Island deaf and hard of hearing citizens have full access to public audio and visual information and communication through sign language interpreter services, captioning, and technology. Secondly, opportunity to create new opportunities through advocacy, policy, education, employment, and legislation for all Rhode Island deaf and hard of hearing citizens. Third and last, equality, to promote equality in the communities and society for all Rhode Island deaf and hard of hearing citizens. I think it's excellent that we review it at every meeting so we never forget why we're here. Okay, next on our list is going to be public comments. Do we have anybody here from the public that would like to make a comment? Give people just a moment. You can either switch on your video, you can speak, you can click the chat. All right, if there are no public comments at this time, we're going to move on to our, let's see, our meeting minutes. So Bethany, if you would, just pull that up very quickly. We're going to do a quick 1-minute review. Ernest has sent the meeting minutes to the commissioners. We just want to review it briefly to ensure that everything is correct, and then we can make a motion to accept and vote. So everybody take a moment just to review the meeting minutes, please. This was from November 17th. Thank you, Bethany. If all looks appropriate, I would be waiting for a motion to accept these meeting minutes as reviewed. Betsy, did you have your hand up?
Yeah, I'll make a motion to accept the November meeting minutes as written.
And I'll second it.
Excellent. All in favor to accept the meeting minutes? You can just turn your video on, give us thumbs up.
Now, I'm not able to vote if I was not present, correct? This is Drew
Correct.
asking.
Okay, Caroline. Tim, Betsy, thank you. Boomy, excellent. I believe that's enough to pass the meeting minutes as accepted. Next on our agenda would be the Executive Director's Report. Ernest, are you available at this time?
Yes, hello. Okay, hello everyone. So nice to see all of you again. I know here we are yet again back on Zoom. Firstly, I wanted to make sure.
Hold on. Is there any way that you can take your mask off for clarification purposes? Only if it's safe to do so.
Just because I do have another person here in the office, but I believe that we are distanced enough
Okay,
that should
as
be
long as you're
okay.
safe to do so. I apologize for interrupting. Please continue.
Yeah, it's only because I have another person here in the office with me, but like I said, I think the distance is sufficient, so I can, I'll go ahead and proceed. So I'll start again. Hello, everyone. Nice to see everyone again. I know here we are remote, although we were in person at one time. But thank you so much for your support in making sure that this meeting can happen, albeit remotely. There have been rising concerns about the COVID numbers, so I'm glad that we had the capability to meet this way. We will remain meeting remotely until February 4th per the governor's orders. At that time, the governor might decide to extend their executive order and have that go on further or not, but we're still waiting to hear. And if we don't hear anything, then we're assuming everything will return to in-person as of that date. Once we know more, we will make sure to get that information out. But as of right now, February 4th is that impending date. And we'll know more if we'll be continuing in person or if we'll have to have subsequent meetings remotely again. So now for my report, I wanted to start with the COVID updates. So there've been some announcements with in terms of the vaccinations. And so the commission has been working with Rhode Island School for the Deaf to partner on hosting various clinics for vaccinations. So please keep an eye out for our announcements to get the specifics as to what dates and times those will be happening. You can either register ahead of time or you can come in on a walk-in basis, but due to the rising numbers, I would encourage you all to get your vaccination or your boosters. And some exciting news is just this past Saturday, we did have another vaccine clinic at Rhode Island School for the Deaf, and Governor McKee and their team was present. They came and joined us there and was able to mingle with the deaf community, with the deaf-blind community. We had interpreters available to facilitate that communication, and it was really nice to have them present. And I want to extend my thanks to the governor for making themselves present and for being available to the community. It did take a lot of back and forth to get that scheduled, but luckily it was a success. And thank you to Mike Bear, our emergency planning coordinator, who was able to be present representing us as well. We also had the executive director for Rhode Island School for the Deaf who was there, and thank you for their willingness to host this clinic and for allowing the governor to come and get a feel for our community and to learn a little bit more. And thank you to all the other folks who were there from the commission who got this set up and were able to coordinate interpreters. We had Rob, and we also had a CDI, Jesus, who were there and present and able to facilitate that communication, which was of great interest to the governor as well. They were very interested in seeing that process happen live. We also had Tina, another interpreter, who was able to make it. Now, there wasn't any media involvement. It was more of a low-key event, but it was nice that the governor was able to interact directly with the community, and it was a really positive experience for everyone involved. So I'm really thrilled that we have that relationship with the governor, and now it was all able to come together, and we were able to make it happen. So again, thank you to all who were present, and thank you to Mike for being there to represent us as well. Now, I just talked about the the open meeting policy. I've already explained that, so we'll move on to the next item here. Masks are still mandated in all state buildings, really everywhere. That's an executive order from the governor that masks are still required. Now, it's not required that you have an N95 mask, but it is preferred because that would ensure your utmost safety. The fabric or cloth masks aren't as safe. They're not as durable, so they don't stop the spread of the illness as much as the other ones do. So that was what we would recommend to ensure your safety. Now, with recent press conferences, it has been difficult. There's been a lot of issues in terms of getting interpreters there and whatnot. So we've been communicating with the governor's press team directly. And from those conversations, we were able to discern, we were able to inform them that they cannot give us last minute notice because it's extremely difficult to find an interpreter on such short notice. We really need as much notice as possible. They have to be scheduled ahead of time. So we were able to articulate all of that to them. So thank you to Pam and to Mike and to Bethany. I'd also like to thank Holly St. Pierre for being able to make sure that the governor's team was aware of all of these barriers to being able to make this happen. And we were able to say how important it is to have an interpreter available. The community really misses out on access to that information because the captions we know are not accurate all the time and they're not always clear. And this is really important, relevant information about COVID, about the governor's announcements. And by the time the deaf community might have access to that information, it could be much later. That's not equitable access. So we needed to make sure that they understood the importance of having an interpreter there on the screen. So we were able to articulate all of that to them, and they seem to be convinced and to start to realize why it's so important to make their requests ahead of time as possible and to not do so on such short notice. And so far since that meeting, it seems that we've been getting their requests more in advance, as much as a month in advance. So we are thrilled that our communications seem to make a difference in their understanding of this process and why communication access is so critical for the deaf, deafblind, and hard of hearing community. And so again, thank you to my team for being able to work so efficiently together to make sure that the governor's press team was able to access this information and get a better understanding. I don't know if Mike, you would like to take this moment to add on to anything or comment about any COVID issues or whatnot.
Mike saying, Ernest, thank you so much for calling on me. I just turned on my video so he can see I'm interpreting. I think Ernest covered pretty much everything I would have said. I did want to let the commissioners know that we have made 2 videos, one with a mask, again, about the CDC's recommendations of N95s and KN95s. A lot of people are worried about the price. They're very expensive and people are saying they can't afford it. I've heard a lot of feedback about it. And I'm saying it is recommended. It's not mandated. And if people can't afford it, and I have to admit, I mean, I haven't bought a lot of them. I bought 1 or 2, but you can double mask. You could have a cloth mask and you could have a surgical mask and wear them one over the other. I did stress that. Tomorrow, the governor is doing a press conference, and I want to just make sure if there is any new information, and if not, I will disseminate the information more about the mask. The second one the second video was how to protect yourself and others. The CDC has updated their guidelines as of this last month. to remind people or to really encourage people, there are 11 different items that you can do that are tools to fight COVID. And if everybody did them, COVID would be much diminished. And those 11 are not difficult. They're pretty easy. So the 2 videos, and then I'm waiting for tomorrow to see if there's any news about the mask, and I'll send those out. Ernest did cover the vaccine clinic. There will be another one on February 18th. Starts on a Friday, because what I had been saying was Saturdays, but Nancy McGuire Heath said Fridays because of the students. There are some students who are not yet vaccinated or haven't gotten their boosters yet, and their families don't have boosters yet either. So following Nancy's recommendation, we're going to meet on Friday instead of Saturday. And the DOH, the Department of Health, has said they will continue this idea of having a deaf designated clinic once a month. People can go on their own to any of the CVS or Walgreens or state-run clinics, but they won't have communication access. They could go to the Rhode Island School of the Deaf and have guaranteed communication access. So thank you, Ernest, for letting me speak.
Great, and thank you, Mike, for sharing. Appreciate that. So we're hoping to see, a downtick in these COVID numbers, but no one can be sure when it will truly come to an end, unfortunately. Moving forward, we have been working with HKNC, the Helen Keller National Center. We have been in talks with them through various meetings in hopes to establish SSPs, support providers for the deafblind community. And they're not the only entity that we've been in communication with. We have also met with several stakeholders from all over Rhode Island, with the primary focus of service provision for the deafblind community. At our recent meeting, there's been around 20 stakeholders who have been in attendance. We just met, it was yesterday. And we had a really great dialogue, a strategizing session, so to speak, about how to possibly get this program set up and in place and started. And, an important reminder came up that we cannot do so without the inclusion of the deafblind community at the helm. We also want to make sure we take our time to do it right, because we want it to be something that can be more long-term and not something that would fold, upon after a year or two. So we really want to take it slow and make sure we do our due diligence and follow all of the correct steps in getting that implemented. But we know it is important to have that here in Rhode Island, because several deafblind folks have communicated their discontent with the services that are available in Rhode Island. They often are left relying on family members or friends, neighbors, and then are beholden to their schedules and not able to do things on their own time or when they need to. And having to ask a family or friend also means that if that person is not available, the deafblind person is not able to go out and do what they need to do. They also expressed feeling isolated and not having access to the community, and not having equal access to a lot of different meetings and things that are occurring in the community. And one thing that's important to stress is that this SSP role is not someone who would serve as an interpreter. It would be a support person for the deafblind person. That individual would still have full autonomy. It would not be as if the SSP is taking over any of that decision making or anything like that. They would just be providing support. We did have an event on December 4th where we had around 8 members of the deafblind community come, and we were able to listen and hear them share their voice. And a lot of what they shared really hit us pretty hard. It really had an impact on us. So we need to make sure that the services that we're providing are appropriate and advantageous for this community, and currently they're not. So we would like to work to implement this program and make sure that it's something sustainable for the deafblind community in Rhode Island. Our next item here is that we've also been focusing on outreach for the deaf and deafblind community. We want to have a stronger rapport between our office and the community. We'd really like to improve that relationship. So our 30th anniversary kickoff will be this year, and that event planning is already in progress. Pam Zellner, she's already been meeting with several different commissioners because she will be doing a project where videos will be sent out through social media on a monthly basis. And because we're celebrating 30 years, we really want to, reflect on our history and moments of achievement and whatnot. So those videos will be posted via social media. They'll also include a trivia question, different things about when certain things were established or when something notable happened. So that will be started. You can expect to see that in coming months. And we hope to share more information about all of those events with the commissioners soon. So after that meeting with the deafblind community on December 4th, we also heard from them that they were interested in setting up a support group, a place for them to come together and brainstorm or just share about their lives. That was the feedback we had received from them. And also this might be an avenue for them to share feedback with the commission as well. So we have already reached out to several deafblind folks to see if they were interested in a support group, but a lot of people expressed hesitancy due to COVID and their preference for it to be in person, but the hesitancy to do so now because of the uptick in numbers. So we really need their support to move forward with this. We cannot do so without their involvement and without them at the helm. We really need their support to implement this. So we're starting the conversations, but the support group won't actually be in place as of yet. We need to have further conversations with members of this community. Now, I'd like to talk about our legislative proposal. There's been conversations with the Rhode Island Foundation about the federal funding. And unfortunately, we were given a bit of bad news. The funding slate has already been submitted, so the Rhode Island Foundation wasn't able to get any of that money. So we would need to reach out to legislators to, oh, sorry, it's freezing for me. We would need to reach out to legislators to argue for why we would need some of those funds to support our community through, funding for interpreters or for community access or whatnot. But we're not sure what those funds will end up being. We still need to stipulate what we would be utilizing the funds for. Interpreters for healthcare providers, or to grow the interpreter pool, to improve access in a general sense. So those conversations have just begun, but we'll continue to seek their support in funding.
So we're just going to switch interpreters. Great. So after that meeting with the deafblind community, I was thinking they should be recognized in our name. Instead of the Rhode Island Commission for the Deaf and Hard of Hearing, it should be the Rhode Island Commission for the Deaf, Blind, and Hard of Hearing. So it'd be RICDBHH. Other states have already incorporated the term deaf-blind. The Minnesota one, Colorado one, you can see the DB showing up in the acronym. Michigan. Washington, D.C. has a commission that is already involving the deaf-blind. But Rhode Island Commission for the Deaf and Hard of Hearing, it's read as a kind of a rejection or a marginalization. And I think it's so important to show that we value the services and the needs of deaf-blind people. And I think with the mission statement and the vision statement, we have the term deaf-blind in that language already. It's already there. Why don't we add it to our logo and our official title? So I'm going to want to propose that. I'd like the commissioners to talk about that and to vote after some discussion to support it. And then I could propose it to the legislature to change our name to the Rhode Island Commission for the Deaf, Deafblind, and Hard of Hearing. I feel that they deserve that recognition. They have been so isolated for so long without services, without the assistance that they needed. And it's important at this point to recognize them and give them the support that they need. So another item on the agenda, we know that people in the community have been concerned about the process for filing complaints, how they could even get the information so that they could move forward. So we have decided to set up a vlog video to explain the process of complaints, how you would go about it, where a complaint would be filed, whether it would be, let's say against a healthcare provider or a private facility or against us as the commission. So we will explain the process, the how-tos, and all the different categories of complaints. I've already, excuse me, the interpreter made an error. That has already gone out to people, and I'm hoping that the community realizes that we are trying to assist them because it is in ASL with clear steps showing on a sequential basis how you go through the entire process, different tips for filing those complaints. So I am hoping that that's satisfactory. I have not heard anything since it went out, but I want people to know that it benefits them and that they can move forward with the complaint process. The last item on my agenda is the issue. We have been so frustrated where we cannot get interpreters for our communication need. We have deaf staff here, myself, Pamela Zellner, and Michael Bear are deaf on staff at the Commission for the Deaf and Hard of Hearing. We have a hard time finding an interpreter for very important meetings that we have. We look and they're not available. Sometimes we've had to delay and cancel meetings because of the lack of interpreters. We end up having to depend on interpreters who come from other states and have them come to Rhode Island. We use tier 2 interpreters, and we feel like we want to give equal opportunity to the tier 1 people who are already on the MPA, who are Rhode Islanders. We're hearing a lot of comments and feedback, this kind of scuttlebutt out in the community about how we're functioning, but there's nothing we can do because of the lack of interpreters, the actual lack of the numbers. And we want to build relationships so that we can provide communication access. If people refuse to provide us interpreting services, that punishes us. I know that people are speaking badly about the commission, and therefore some people are like boycotting taking assignments from us, but we want to improve relationships with the community. We're here to serve all deaf and deafblind people in the community and the hard of hearing people here. We want to work in partnership, and we want to make sure that interpreters provide that kind of access. If they remove that access, we cannot give our essential services to the community. If we set up meetings and we're reaching out to interpreters, it just feels like we're not doing what we need to do to build the kind of relationships. I just want to put that out. We don't know how to resolve this issue. We want to build better relationships, and I'm hoping that people will tell us what we can do to connect better with the interpreter pool that's out there and resolve this situation, because it is so frustrating. That is my report. I'll wrap up here. So thank you so much.
Thank you, Ernest, for your report. I think maybe a good segue into that, we're going to begin with our commissioner's report. However, there was a comment in the chat requesting a public comment. Let me see. I believe it would be Amy who had asked if we were going to do a public comment. We did have a moment in the beginning of our meeting, but I'm going to allow it Amy, if you're available and ready to make the public comment, we'll do that quickly before we begin our commissioner's report.
Thank you. Will do. I may have missed that. I did not notice that announcement, but I do have some things that I wanted to mention. One was, I don't know if you're preparing for this weekend with the bad storm, and I don't know if there should be interpreters ready because there might be some emergency announcements. It's supposed to be extremely bad, and I'm thinking that that's one thing. Another thing, I'm wondering if, Ernest, if we could talk about some other agencies, like as the whole working with SSPs and deafblind people. I have done some research myself, and I was thinking that maybe we could get some more funding that would allow us to have a subcategory under the commission, but it would be RICD, DBHH, but a subcommittee or a sub department that specializes in deaf-blind people. That's just one thought I have about the Commission for the Deaf. And the thing about the lack of interpreters, I think the relationships have really been damaged. And I have talked with the commissioners before in the past. I know there's the ad hoc referral committee for interpreter referral services, and there's been some issues with the interpreters, the community, and the commission, and we do need to work on resolving it, but it's really been damaged. So thank you for letting me speak. Tim is saying, hello, I did want to say something. I have some information for both Mike Bear and Ernest, if it's all right, if I could share something, it's related directly to their report.
Tim, absolutely. If it's pertinent to their report, please do share it.
Great. All right. So 2 items that came up related to COVID home tests. There are, there is the government effort to send 4 home tests. President Biden is allowing people to fill out paperwork. And so we should encourage deaf people. It's a very simple form that you put your name and your address, and you will get 4 tests through the mail from the post office. And then soon they're going to be distributing N95, actually maybe KN95, I'm not sure which, will be distributed free through several pharmacies. And I think you need to make some, like CVS or Walgreens, Stop and Shop pharmacies. If people cannot afford them, as you had stated, they are going to be distributed free, and they just need to be requested. I'll make some other comments later, but I did want to make those points pertinent to COVID. Thank you.
Betsy, you are muted, Betsy. There we go.
I have a similar comment. The Cranston Public Library is distributing free N95s. The Warwick, Burrillville, and other public libraries have free COVID test kits. I picked up one for 2 people, 2 tests. I think it's first come, first serve. Starting last week, I'm in a library book group. I got a notice saying that several libraries across the state, I don't know the list of all of them, do have some free masks and test kits, and people can call their library to find out about them.
Thank you, Betsy. Thank you, Tim. I think right now might be a good time to take a quick break before we begin our commission report and then continue on with our committee reports. So let's quickly just take a 10-minute break. Everybody go get a drink of water. It's 6.
Sorry, I wanted to just say, Kimmy, sorry about I'm sorry, that just one thing that Bethany needs to say, sort of an
Mhm.
emergency announcement.
In regards to the impending weather, there will be a press conference tomorrow. It does have ASL interpretation coverage. I did speak with the governor's office about the weather. They said that it may be mentioned at tomorrow's conference, and that they will know better as of tomorrow the exact trajectory of the storm, and they will make a decision then if they will either have a public announcement, any press releases, or if they will have a conference. At this time, they are not, and will address it in tomorrow's conference if there is anything to address.
Mike is saying, if I could speak for a second, I do want to, Kimmy, I wanted to follow up with Bethany's comment about the weather, the winter weather advisory that's coming up. And Amy, thank you so much for bringing it up. I really appreciate it. Believe me, that's something I always have my eyes on when we expect, if there's even a possibility of a bad storm, like there, something coming our way. I always reach out to people and say, let's get ready. The last time, a few weeks ago, it passed us, but the governor's office, it's difficult because with those emergency situations, you can't really prepare ahead of time. It's always last minute. But internally, within the Commission for the Deaf, the staff are very aware. Bethany is ready to reach out to interpreters to actually check with people to see if they're available for the next coming few days. It's not a commitment, but at least some sort of a loose support for availability so that we can say we could provide that. 2 or 3 weeks ago, do you remember that one that was happening and it didn't end up coming to us? But we did put out a notice, and there were several important links on the press conference. There was warming centers set up. If your heat in your house went out, there were places that you could go to keep warm. So this week, Thursday and Friday, we'll be keeping a close eye on the weather. So that's the first item. The second, Tim and Betsy both talking about the kits and the masks. Thank you for reminding me. Yes, the N95 is being distributed by the government, and we do have information ready about that. I actually was waiting for the press conference tomorrow before I release the video. I want to follow the Department of Health and the governor, what they announce about how people should access those. I know the US federal government has already acted, and Ernest and I have discussed that and said it should be relative to Rhode Island if the Rhode Island governor makes a statement. So people, it might get a little delayed, but it is on my list. I will make a vlog and I will send it out about how to access that. So thank you both, Tim and Betsy, for bringing that up and reminding me. And back to Kimmy. Thank you.
Thank you, Mike. Excellent. If anybody else has a comment, if not, we will just take a quick break. Okay, so at this time, it is 6:58. Let's return back here. Let's say 7:10. That should give everybody enough time. Thank you.